Imagine waking up to find your local hospital chained shut, the emergency room sign dark, and the place you relied on for care now just an empty shell. This isn't fiction, it's a real threat facing many communities, especially in rural America. When a hospital closes, emergencies become life or death gambles, and the safety net vanishes. It's not just about inconvenience, it's about survival. You might think your hospital is safe, but its stability is tied to a single government program, one now facing massive cuts. Hospitals are businesses. They need funding to keep the lights on and staff paid. For many, a huge chunk of that money comes from one source, now on the chopping block for $880 billion in cuts. This isn't a trim, it's a decapitation. To understand the threat, you need to understand the most important and misunderstood healthcare program in America. Let's talk about Medicaid.
Are you looking for a flexible way to earn income from home while making a real difference in people's lives? Become a non-attorney representative and help others navigate the Social Security disability process. No specific background or law degree required. We provide expert training, resources, and ongoing support so you can start your own rewarding business from anywhere. Ready to learn more about this little-known, long-term career opportunity? Visit our website at www.ssahelp.com and take the first step toward a meaningful new career path today. See our link in the video description.
Medicaid isn't just healthcare for the poor, it's the largest health insurer in the country, covering over 85 million Americans. It supports children, pregnant women, seniors in nursing homes, and people with disabilities. In many communities, especially rural ones, Medicaid is the financial lifeline for hospitals. It pays for nearly half of all births and covers over 60% of nursing home residents. Without Medicaid, the financial model of American hospitals collapses. The program is a partnership between the federal government and states, providing critical, reliable funding. That funding keeps hospitals open, staff paid, and care available to everyone. Proposed cuts threaten the very foundation of our healthcare system. Cutting Medicaid is like pulling out the load-bearing walls of a building. The people hurt most aren't statistics, they're our neighbors, our families, and in a crisis, us. How do you cut $880 billion from Medicaid? With terms like block grants and per capita caps. These sound harmless, but they mean giving states a fixed, limited amount of money, no matter what happens. Right now, federal funding rises if more people need care. With block grants, states are on their own. If costs spike, say from a pandemic or new treatments, there's no extra help. States face impossible choices: raise taxes, cut other services, or slash Medicaid. That means fewer benefits, lower payments to hospitals, and people losing coverage. Proponents call it flexibility, but it's really about deciding who gets care and who doesn't. The Congressional Budget Office warns millions would lose coverage. This isn't a side effect, it's the plan. The result? Hospitals and patients left stranded, the safety net unravels, and the consequences ripple through every community. When people lose insurance, they still get sick. They just can't pay. They turn to the ER, creating a flood of uncompensated care hospitals can't sustain. The result: hospitals cut vital services, lay off staff, and eventually close. The economic heart of the community fails, turning a healthcare crisis into an economic one. We've seen this play out. States that didn't expand Medicaid have lost over 130 rural hospitals since 2010. A hospital closure affects everyone, even those with private insurance. Remaining hospitals get overwhelmed, wait times soar, and costs rise for everyone. A hospital is an ecosystem. When it dies, the whole community suffers. Healthcare deserts form, and basic services disappear. The loss is felt by all: patients, workers, families. It's not just about health, it's about the survival of entire towns. The stakes couldn't be higher. This is daunting, but it's not inevitable. These are choices made by elected officials, and they need your vote. Awareness is power. Talk about Medicaid's role in your community. Share the facts, correct misinformation, and frame the debate as a choice about our values. Get local. Ask your state and local leaders where they stand on Medicaid. Make it clear their stance will decide your vote. Protecting Medicaid isn't partisan. It's about community survival. It's about ensuring care is there when you need it. These cuts aren't a done deal. They can be stopped if we speak up. The future of our hospitals, our healthcare, and our communities depends on it.
Please like and subscribe to our channel. We have so much more to share. Thank you for watching.